So our first question is from Megan, and the question is, your new patient has either joint muscle wear issues that need to be addressed, or they are in an ideal relationship and have a system that's working but isn't ideal. And how do we delineate those patients in our practice during recall visits? So well, why don't I throw it to you first, Raj, and why don't you handle this first one?
Sure. Actually, this is a really common thing, especially with either a legacy practice or a practice that you've had for quite a while. You have patients coming in on your normal recall schedule, and you start noticing the things that you had maybe overlooked before. And one of the great things is that it's an open conversation, a way to just start having a dialogue, maybe with a photograph, and start discussing some of the issues in a very non-confrontational, non-pushy sort of way. And usually in my office, it opens the door to start the conversation. I start discussing a few of the issues. If a patient seems like they're engaged and want to take that discussion further, we go on for a few minutes. If it looks like they want even more answers, then we say, hey, you know what, let's set aside a little bit of time when we can study your case a little bit more and look at some of the changes we've seen over the last couple of years occur to you and see what our possible solutions are. So that patient then ends up being basically a records or a new patient in the office at that moment.
Well, that's great. You know, and one of the things that we have to remember is that as we're in general dentistry practices, we're always going to be creating these two pools of patients. We're going to be having our general dentistry patients on one side and our complete care patients on the other side. And we're always going to be having a flow of patients from the general dentistry side into our complete care side. And so what you're going to find as your practice begins to evolve is you're always going to have patients in a constant state of flux, meaning that you may have patients that have signs of instability, have wear, migration, mobility in the occlusion, the dentition, maybe they're having joint issues, but not everybody is always ready to immediately jump into that complete care side. So what we're doing in my practice is those patients that have signs of instability that need to be addressed and they haven't addressed it yet, we're always kind of communicating to them, giving them nice gentle reminders of what's going on in there, asking questions about signs and symptoms that they may be having, and just waiting for the right time for them to transition into that complete care side. So you're always, as you progress through this practice, this transformation in your practice, you're always going to be having a give and a take and a pull and a give as the patients start to understand the long-term implications of what's happening in their mouth and in their system, and they're ready to start to address that. So that's a great question, and it's one that we see, like Raj said, we see it all the time, and so it's a great question, yeah.